Yes, yeah,
Thank
yeah.
you.
Thank you very much.
Yes, it's a pleasure to be here and to be back with each of you.
Mm-hmm.
I think most of the students know me by now. Um, so for those who don't, I am faculty at Columbia University and the School of Nursing. I'm trained as a clinical psychologist with expertise in cancer prevention and control.
Mm-hmm.
Specifically, I'm interested in smoking cessation interventions as a strategy for reducing risk for cancer and poor outcomes associated with cancer treatment. Primarily, my work is focused on intervention development. And so I am not um, a pure qualitative researcher, but I have come to mixed methods research designs as a way to help inform my development of intervention protocols. So what do I mean by that? As I The work that I do is aimed at culturally targeting smoking evidence-based smoking cessation treatments for specialized populations. And when we are looking at differences between population groups based on gender, race, ethnicity, or sexual orientation, there are universal factors that are associated with risk for smoking and poor outcomes associated with smoking cessation. But we also know that there are population specific or unique risks and protective factors. So for me, one of the ways in which I am able to develop interventions that are targeted to specific groups is to use a combination of mixed methods approach in which we are looking at initially qualitative findings from focus groups to better understand some of the unique attitudes about smoking cessation treatments, the factors that have um, made it difficult for them to quit smoking in the past, and misinformation about smoking cessation treatments, such as the nicotine patch. I'm able then to collect this information and to be able to revise or adapt a standardized treatment approaches to incorporate what we have learned from the qualitative research, the focus groups, in order to better to include some of the issues that are unique to special populations as part of the intervention. After I have adapted the curriculum, then I go back to in-depth using qualitative research, in-depth interviews in order to get feedback about the revisions or the adaptations that I have made based on the initial qualitative findings. So I will ask them about, um, did we capture this information correctly? Do you see any information that doesn't feel correct to you or feels offensive to you? Um, and then we get there, or is there anything that you don't quite understand about our curriculum or the information? We take that feedback, do the final revisions, and then we test our adapted intervention. So my use of mixed methods is primarily in service of being able to adapt and refine smoking cessation and other types of treatments for special populations. So a lot of the examples that I will provide you will be related to intervention development, but not exclusively. And so, but I just wanted to give you that background in advance. So the objectives today are to describe mixed methods, research approaches, to identify the most appropriate uses of mixed methods. I've described one to you, and that's intervention, adaptation, and targeting. to give you some examples of research designs and then to discuss some of the criteria for evaluating the methodological rigor of mixed method studies. So let's start with a working definition. What do we mean when we say mixed methods research? It is a strategies for conducting research that integrates the strengths of both qualitative and quantitative research methods within a single study or project or series of projects that combines the strengths of both types of approaches. The overall objective is that is to have a better understanding of the phenomenon or the research topic or issue that you're focused on, having a better understanding than what you would have been able to achieve by looking at qualitative information alone or quantitative information alone. So in mixed method research, researchers collect and analyze both types of data, qualitative and quantitative, and then the results are combined during the integration or interpretation phase. This interpretation can occur at different phases of the research process, including data collection, data analysis, or when one is interpreting the finding. So again, using mixed method approaches, researchers can gain a deeper understanding of a problem by examining the what, the quantitative, and the why, the qualitative. So those are sort of related to the strengths of each kind of research methods. So when is mixed methods useful? It's particularly useful in areas where there is the need for multiple perspectives to be understood around a topic. And typically this is a new topic or new area or phenomena that's being explored. Secondly, when there's a need to validate or explain quantitative findings, or when researchers are trying to capture both objective and subjective aspects of a phenomenon, objective quantitative evaluation and subjective qualitative evaluations. All right, before we get very deep into looking at mixed method designs and features, we really need to take a few minutes to review the key aspects of qualitative and quantitative research. Given that you're in the course for qualitative research at this time, a lot of this should be familiar to you. So how do we think about qualitative and quantitative research? Both of them are strong methodological approaches, but they are meant to answer different types of questions. So for quantitative research, the purpose of these types of methodologies is to study relationships between variables and to be able to evaluate cause and effect as in terms of an intervention. That's different from the purpose of qualitative research. Qualitative research is meant to examine a phenomenon very, very richly and in very deep detail. The designs also differ. In quantitative research, each of the aspects of the study design are established a priori. That means in advance of conducting the study. Whereas qualitatively, we have a design that we will use, but there is room for flexibility and for that design to evolve over time. For example, if we start off with a series of questions that we're asking participants, and we realize after the first several interviews that a new theme seems to be emerging that we haven't been explicitly asking participants about. At that point, we may stop in a qualitative design, frame a question that revise the moderator's guide to specifically include that question, and then more systematically evaluate it in the rest of the participants. So it's can be much more flexible. Now that doesn't mean it's less rigorous, but it allows for more flexibility. The approaches are deductive, theory testing versus inductive, with the possibility of able to generate theory. The tools are pre-selected measurement instruments, either surveys or blood samples or some behavioral outcome. Whereas in the qualitative design, the researcher is the primary data collection tool. And why do we say that? Because as Ajan will be able to attest to, it requires a great deal of training and expertise to be a very effective qualitative interviewer. In terms of the samples, quantitatively is based on large sample sizes, and the sample sizes are typically determined by sample size calculations or power analysis. Whereas with qualitative studies, the sample sizes are typically much smaller, and the final sample size is based on saturation, meaning the point where you're not getting any additional information after interviewing more people. Okay, so sample sizes are typically much smaller. In terms of the analysis, statistical analysis of numeric data versus a narrative description and interpretation of the words and text that get generated as a result of the focus groups or in-depth interviews. So those are some of the key comparisons. When do we use each of these types of approaches? They differ in purposes. So qualitative research we use when we're trying to have an initial understanding of an issue or problem. So for example, burnout associated or emotional response among nurses who are caring for COVID patients in the ICU. There was lots of emotional distress and even the development of post-traumatic stress disorder. We knew very little about what were the factors that were putting nurses at risk for PTSD, post-traumatic stress disorder. And so the first steps were to conduct qualitative research to understand the conditions that were causing distress and trauma. And then after that, then we were able to develop checklists or surveys that would allow us to identify the prevalence of these traumatic events, what nurses are most likely to experience these traumatic events, and how strong is the correlation between each of these experiences and the development of PTSD. So that initial qualitative research was foundational to development of questionnaires, and then the ability to look at larger samples and to start to do some descriptive correlational and even predictive analyses between the association of treatment and experiences with COVID patients and stress and PTSD among nurses. The second use is to look for a range of ideas and feelings about something. So going back to our example, there might be differences in experiences of stress for nurses who are in the intensive care unit versus nurses who are working in community settings, caring for testing or caring for COVID patients. So looking at a range of ideas and experiences about a topic, understanding different perspectives, trying to understand motivations or factors that influence opinions or decision makings. Um, a lot of times, and this is the way that I've used it again, to provide information to design a quantitative study or to explain findings from a quantitative study. These last 2 points provide information to design or to explain quantitative research is when I'm most likely to use a qualitative design. Quantitative is not good for necessarily exploratory, right? It's to identify cause and effects, relationships, um, and how strong relationships are, and to the degree in which they generalize to a larger population. And again, it also allows us to test hypotheses and to examine relationships between specific variables. So when we think about the strengths and the purposes of both types of research approaches, we can understand that when used together, that they really are very complementary and can provide us with a much richer understanding of a research problem area. So there are a number of reasons for using mixed methods. The first is related to the idea that one method alone, using only one of these approaches alone, would be insufficient for answering the research question, or that there's a complexity in your research question or a complexity in the phenomenon that you're interested in that both approaches would allow you to have a bit better picture or understanding. And then finally, that we're being more and more encouraged to work in interdisciplinary teams. And some team members have different strengths in sort of in qualitative and quantitative, which allows us to be very innovative in our approaches to research questions. So what is the history of mixed methods research? Historically, objective research and rigorous research was only thought to be associated with quantitative research. Qualitative research was seen as substandard, too subjective, and without the methodological rigor that is in place with quantitative research when investigators follow the scientific method.
And we have the same point of view.
Okay. So, if you have a question, just sort of come on mic and ask. If you don't have a question, please mute so we don't have the background noise. So for a long time, there was the perspective that science and true science was based on quantitative research. Then there became much more research in the social sciences, sociology, anthropology, some parts of psychology that really understood the value of qualitative approaches. And so there was this tension in the field between the folks who thought qualitative research was appropriate and the best way of understanding concepts and human behaviors, and then the quantitative researchers who felt that qualitative was too subjective. This was thought, quantitative research was thought to be superior by most institutions and most funding agencies. But starting in the 1980s, there became an emergence of a third methodological approach, that is the mixed method designs. This approach started to be described and used in the early 80s at a time when there was just this 2 methods that were being used. Over time, we have seen a lot more textbooks and a lot more publications about how to improve the methodological designs of mixed methods to clarify strategies, including study design and analysis approaches. So now mixed method research designs are generally well accepted at all levels, from researchers in general, by institutions and universities, and by funders, but at the national and international levels. So mixed methods are seen as equally valuable as quantitative, qualitative, and now this third mixed method approach. We no longer think about one approach as being superior to the other. The way that we think about it now is, what is the research question that's being asked? And is the research question best answered by a qualitative, a quantitative, or a mixed method design? So that's how we decide which approach to take, and it's based on the research question that's being asked. So next, let's look at mixed methods designs. So there are a variety of designs that include both qualitative and quantitative methods. Again, mixed method approaches. Many people have the misunderstanding that mixed method research means that you put equal emphasis on quantitative and qualitative approaches. That is not the case. There are a variety of designs that use a combination of qualitative and quantitative methods. Mixed methods research is any research approach that uses a combination of qualitative and quantitative. Now, the emphasis may be on what type of methods you use might differ based on the design. Some studies might have a primary emphasis on quantitative approaches, and to a lesser degree, rely on qualitative methods. Some mixed methods research designs have an equal emphasis on quantitative and qualitative. And then some designs are much more heavily relying on or focusing on qualitative methods with a secondary emphasis on quantitative. Regardless, each of these types of designs represents mixed methods research. Okay, so mixed methods is not necessarily the equal use of quantitative and qualitative, but is any study that combines in a variety of different ways methods and approaches that include both qualitative and quantitative. That's a key point that I want you to understand. Okay, so when we think about mixed methods research designs, there are a number of questions that we need to cover and procedures that we need to describe as we're developing our research plan. The first is to describe the purpose of the study and the why is there the need for a mixed method approach. Then secondly, we have our research questions that are related to mixed methods designs. As we're putting together our research plan, we have to think about both our qualitative and quantitative approaches or methods. Will we use focus groups? Will we use surveys? And any variety of different approaches. We also have to think for both types of data, for both types of approaches. We have to think about data collection strategies. We have to think about data analyses, and then our sampling techniques, as well as our sample size. So mixed methods means that when you're putting together the design, you have to think about design in terms of both the qualitative approaches and the quantitative approaches, a clear description of each of those. After that, you have to think about how you will integrate the data that gets generated from both types of data collection approaches. And we'll talk about that in just a minute. So when we think about mixed method research designs, there are three types of issues that we need to think about and make decisions on. The first is priority. What is the priority for the study? Is it qualitative, quantitative, or equal balance of both? What is the sequence in which the data collection approach is used? Is that collected at the same time point, qualitative and quantitative, or is the quantitative data collected first, followed by qualitative, or is the qualitative information collected first, followed by the quantitative? All right, and the final is the stage in which the findings are integrated. Are they integrated, the findings from both approach, qualitative and quantitative? Are they integrated at the middle point of the study data collection? Are they integrated at the end, or is it multiple points of integration and that are being considered? So that the decisions that need to be made, priority, the sequence, and the stage of integration. Let's talk about each of those. So first is priority. There are three designs that can be thought about when we're thinking about priority. The first is qual quant, and that is priority is given to the qualitative data analysis, and secondary is the quantitative. This is often referred to as exploratory mixed method design, in which the qualitative data collection comes first in order to describe an experience or a phenomenon. And then the data are from the qualitative phase are used to develop a survey instrument or a series of questions to be able to evaluate how generalizable or how strong are the attitudes and opinions about an experience or a phenomenon. Okay, so the first priority and the type of design is exploratory, and it is characterized by primary emphasis on qualitative and then to a secondary degree quantitative. The next approach is an exploratory design. That is when we are primarily focused on quantitative data collections and findings, and then we follow up the qualitative to better understand the data that we receive. So the quantitative study is done first, and then we have our findings, and then we may follow up with interviews or focus groups to try to help us to better understand the quantitative findings from our survey, right? Usually usually this explanatory framework is used to help to interpret quantitative results. And finally, we have what's called triangulation, an equal emphasis on the qualitative as well as the quantitative. It draws on the integration of both methods, and both sets of data are given equal weight in terms of data collection. So priority, the decisions that you have to make related to exploratory design, an explanatory design, or a triangulation design. Right? The next decision that needs to be made is the sequence. What is the sequence in which you will collect the data? There are 4 possible sequences that are been most commonly described in the literature. The first is convergent, otherwise known as parallel or concurrent. The other next is sequential, embedded, or multi-phase. Let's look at each of those. So with convergent designs, a researcher collects both qualitative and quantitative data and at the same time, right? And combines that information to better understand the patient's experiences. Merging data, data analysis consists of merging the 2 types of data that are collected as part of the same study at the same time points, approximately the same time points, and to analyze the results. So here's what it looks like. We collect at the same data collection period or within the same study, qualitative data, quantitative. We collect the data, we analyze it, and then we compare and contrast the findings to come up with a final interpretation and a final ability to be able to answer the research question. That's a convergent design, convergent parallel design. Here's an example of a study that I conducted that used a convergent design. This was a study that was looking at genetic testing for breast cancers. As you may recall, in the late 1990s and early 2000s, we had developed biomarkers for increased risk for breast cancer. Those were referred to as BRCA1 and 2. These, again, individuals that had these mutations were at increased risk for breast, ovarian, colon, or prostate cancer. What we were finding in the literature is that there was very little uptake in genetic testing and genetic counseling among African Americans, even though the death rates from breast, colon, and prostate cancers were quite high among African Americans compared to other populations in the United States. At this time, I was working in a hospital setting and working in the cancer center, working with Dr. Olapati, who had expertise in inherited cancers in Black populations. And one of the questions that she was interested in knowing from me, a behavioral researchers, are what are some of the attitudes about genetic testings and what are some of the barriers that are being encountered, and in order to help us develop interventions that can relate to improved uptake and utilization of genetic testing among African Americans. So that's the context of this study. We used an explanatory approach where we were equally interested in the qualitative and quantitative findings. We conducted focus groups, and immediately before the focus groups, all the participants completed a survey of their demographics, their knowledge about about inherited cancers, and their attitudes of screening for inherited cancers. The surveys were collected first, and then we went straight into the focus groups. As a part of the focus groups, we had a lot of concern and pushback about the potential risks and the dangers of this type of genetic testing for African Americans. The participants expressed strong concerns about the Black community as it related to genetic testing. They were linking it to the history of unethical research that was conducted by researchers and physicians using Black populations that caused a lot of damage. And so they were suspicious and had a lot of mistrust of this, what they saw as something new and experimental and something that they thought could be used against Black patients. Immediately after the focus groups were over, we were so disappointed. We're like, oh, this community has a lot of negative attitudes about it. Genetic testing is going to be very hard for us to develop strategies for helping to improve their use of testing, even though it results in better clinical outcomes. And then that was our initial impression. And then we evaluated the survey data, which gave us a completely opposite picture. In the survey data, they were very positively inclined to engage in genetic testing if it was recommended to them by their providers. So how do we explain both sources of data? Is one wrong? Is the other wrong? Are they both wrong? Are they both right? In this case, careful analysis showed us that they were both right, in the sense of when we look very closely and listen to the qualitative interviews again, it became clear that the participants were responding to the question of, is this a good thing for the Black community? Versus with the survey, the participants were answering the question of, is this something that I would consider for myself personally? So the reference point was different. On the one hand, the focus groups were talking about the larger African American community in which they had a lot of concerns about exposing them to potential risk. And the survey was asking about their own individual experiences and willingness. And so what we learned from integrating both sources of information is that one of the things that we really needed to address was concerns about potential harm that this test could do for the African American community, to make it clear that this was not an experimental design, that it was evidence-based, and that many physicians and providers were supporting and recommending their patients to use genetic testing to reduce the risk of dying from cancer. So this is an example that I like to use because it's a clear example of, if we had only used focus group data, qualitative data, we would only have understood one half of the picture. If we had only used the survey data, we would only have understood one half of the picture. But by having both sources of data, combining them, and then very carefully interpreting what the combined results were telling us, then we were able to develop an education approach for this population. Okay. Any questions about this project, and this project as an example of the benefits that can be seen between using simultaneously qualitative and quantitative approaches? Any questions, comments? No, clear? You want to ask if they have any questions, comments?
ใครมีข้อคำถามในช่วงนี้ก่อนไหมครับ ก่อนที่อาจารย์จะ move to our next session. If you have any questions so far right now, please feel free to ask. Yes.
ดีค่ะอาจารย์ค่ะขออนุญาตถามนิดนึงค่ะว่าถ้าสมมุติว่าในระหว่างข้อมูลคอลิกับคอนติอะค่ะพอมันถ้าบางแอเรียแล้วเราเก็บข้อมูลแล้วมันได้ไม่ตรงกันนะคะเวลารายงานผลอย่างนี้ค่ะอาจารย์คือควรงานแบบไหนที่จะให้เกิดแบบเชื่ออันไหนอย่างนี้ค่ะอาจารย์ประมาณ
Okay. So she mentioned about if we get the data, like information from both qualitative part and quantitative part, but the content of the data is quite not related together well.
Mhm.
What we should do, we should rely on which one or how we can manage it.
Yes, great question. Here, in that case, just like with this study, it required a very careful analysis and understanding of what are some of the concerns with this population. So knowing the larger context of mistrust of research among African Americans due to historical abuses conducted that were in place by researchers and the medical community. There has been a lot of awareness of unethical treatment and abuse among among African directed towards African Americans. And so this was coming up. So one way that we'd interpreted this is that the participants view this as something potentially experimental instead of an established approach. And also, we understood the context by thinking about, because they specifically referred to something called the Tuskegee study, in which there was unethical research that was conducted among African Americans participants. So we understood, it helped us to understand a couple of things by knowing the context, the cultural and social context of this population. We understood that they viewed it as experimental, when it was not. So that was misinformation that we could correct. They were thinking about this in the larger context of the history of unethical research. And so they needed to be reassured that protections, this was not experimental, that the risks to them were quite low, and that they needed to better understand, we needed to better understand that many patients were still very fearful of participating in what was viewed as new and innovative research for fear that it would cause harm. That was one part of what we understood, and that made sense. It was very consistent with what we saw in the literature on other areas related to new medical procedures. You want to translate that? Or then the other half was around the understanding that we asked them a slightly different question. With the survey question, we saw much more positive attitudes. Why? Because they were referring to it about themselves personally. I have concerns about how this might be used to hurt the African American community, but me personally, I trust Dr. Olapati, and if my doctor recommended that I have this, then within the context of a trusting patient-provider relationship, I'm more likely to say yes. So that we learned that a strong patient-provider relationship that had trust was able to overcome fear and misinformation that people had about this type of medical intervention.
ครับ I see Isari, do you have a question?
Yes, and I have a question. As I know that when we do qualitative research, the participant, I will collect the data until the data saturation. So I wonder between the mixed method, if we have an inclusion criteria and we conduct each one first, and when we conduct the next approach, we can use the same participant, or we cannot use and separately different participant.
Good. You've asked me two different questions. I'll try to answer both of them. The first relates to sample size. you said that for qualitative research, you looked for saturation. What is the appropriate sample for the quantitative research? It depends on if your primary goal is exploratory, then you would be most concerned about the sample size for your qualitative research. You would make sure that you reach saturation with the qualitative data. Now, when you're looking at the quantitative, that does not, if the quantitative is a secondary approach, you may not need a very large sample size. But if you were weighting them, if the priority was equal, then you would have to reach saturation with your qualitative study, and you would have to have a sample size calculation that told you how big of a sample that you would need in the quantitative, okay? So that's the answer to the first question. It depends on which is the priority. If it's a qualitative priority, you reach saturation. If it's equally, then you need to reach saturation and you need a power calculation to tell you the survey sample size. If it's primarily quantitative followed by qualitative, the first is to have a sample size that based on the power calculation, and then you could have a little bit of qualitative data to give you some preliminary information around your findings. So you may or may not need to reach saturation, okay?
Okay, thank you for your question.
Okay, so we'll translate and then I'll answer the second part of your question. Go
Thank you
ahead.
for the answer.
I'm sorry, since like I've been working on the another part, but I think the idea that Dr. Matthews shared to you, you get the main idea that Professor Matthew tried to share with you, right?
Yes,
Okay,
I think I understand.
okay,
Thank you so much.
okay.
Okay, now the second part of your important question is, can we use the same participants in one phase of the study that we used in another phase of the study? Okay, so can we use the same, for example, if we're doing primarily qualitative and then quantitative, can we use the same participants who were in the focus group with the survey? It depends. The answer is it depends. It depends on the purpose of your research question. So if you are wanting to use you're first starting with, I'll give you an example. I'm interested in developing educational materials to help African Americans better understand the purpose of genetic testing for cancer. I first do a qualitative interviews and focus groups, and I understand their knowledge, their attitudes, their beliefs, their misinformation, some fears, some concerns. I analyze that data. Then I develop a preliminary draft of my educational materials. Because I want to confirm that that I had got the information right after the material development, I will bring back the same group of participants from the first qualitative group to give me feedback on my curriculum. Why? Because I was basing it on the information that they gave me, and I wanted to make sure to confirm, right, to member check that I had understood their opinions correctly. Now I might revise that questionnaire based on the second qualitative aim using the same group of people. Now my next step is to get a brand new set of participants to evaluate my educational materials, evaluate it using quantitative rating scale. How easy was it for you to understand these materials, 0 to 10? How much did you like? How clear, etc.? How useful was the information? Okay. I want to have a different group for that evaluation because I want fresh eyes. The people, if I use the exact same group again, then they're too familiar with the information and the materials, and it would be hard for me to determine, do these attitudes and does this input generalize or hold true for other groups? So in this case, I had 3 phases. The first, qualitative focus groups. I made adaptation to I developed my educational materials. I used those same participants to give me feedback. Then I developed a rating scale, ask a new group of participants to give me feedback. Okay. So it depends on the purpose. Sometimes you want the exact same people because why? You want confirmation. Other times you want the exact same, you want to use very different because you want to understand if the results generalize. So it depends on the objective that you're trying to, of the research question.
ครับอาจารย์ก็อธิบายเนาะเรื่องเกี่ยวกับว่าสามารถใช้กลุ่มตัวอย่างเดิมได้ไหมซึ่งคิดว่าน้องๆก็อาจจะได้ไอเดียเนาะว่าจริงๆก็ขึ้นอยู่กับลักษณะของข้อคำถามหรือวัตถุประสงค์แต่อย่างตัวอย่างที่อาจารย์ยกตัวอย่างมาให้ดูเป็นสิ่งที่น่าสนใจนะครับก็คืออาจารย์ต้องการในช่วงของการเก็บ query เนาะก็ต้องการอาจจะ confirm data เพราะฉะนั้นก็คือเอากลุ่มตัวอย่างเดิมมาใช่ไหมครับเพื่อที่จะเอามา verify ความtrustworthiness อะไรก็แล้วแต่ในส่วนของ qualitative หลังจากนั้นก็คืออาจารย์ก็เอาไอ้สิ่งที่ได้จากธีมที่ได้จาก qualitative เนี่ยมาประเมินอีกทีนึงแต่ว่าใช้กลุ่มใหม่เนื่องจากว่าต้องการมุมมองที่แตกต่างซึ่งก็นั่นแหละครับก็ขึ้นอยู่กับตัวดีไซน์และตัวผมว่าอย่างเช่นพอสมมุติว่าพอไปประเมินใหม่แล้วบางทีถ้าเราต้องการที่จะดูว่ามันยังเชื่อมโยงกับส่วนแรกหรือไม่ก็อาจจะดึงกลุ่มตัวอย่างเก่ามาconfirm เป็น triangular อีกทีนึงก็ได้เนาะอันนี้ก็คือขึ้นอยู่กับตัวดีไซน์ของ research นั่นเองครับ Any question so far right now มีอีกไหมครับหรือพิมพ์ใส่แชทบ็อกเอาไว้ก็ได้นะครับก็เดี๋ยวจะได้ถามอาจารย์เป็นระยะ
Okay. So please ask these questions now because it's about to get a little bit more complicated. So I want to make sure you're clear on some of these general principles because now it's about to get a little bit more complicated.
ครับอาจารย์ก็บอกว่าเดี๋ยวเซสชันถัดไปมันก็จะค่อยๆลงลึกมีดีเทล complicate ขึ้นเรื่อยๆเพราะฉะนั้นในช่วงนี้ถ้ามีข้อสงสัยถามก่อนนะอาจารย์ก็ว่าอย่างนั้นไม่อย่างนั้นเดี๋ยวพอไป complicate อาจจะเดี๋ยวจะแบบว่า loss ไปเนาะมีไหมครับใน basic principle ของ mixed method สุทัศน์เชิญ
in some paper, I wish to ask the professor about in the previous time I read some article that they start with the quantitative research design and they going to get about the collecting data that using the questionnaire and during they get the data from that questionnaire they try to clarify something or that's relate that problem in that topic that their interest. I would like to ask this strategy. They can claim that research is the mixed method or not.
All right. So everybody, will you translate the question? Okay. In time, make sure everyone understands the question because we're going to ask the other class members to answer.
Okay สุทัศน์I give a chance to สุทัศน์ลองพูดเป็นภาษาไทยเมื่อกี้อีกทีนึงครับเพราะว่าอาจารย์บอกว่าอยากจะเอาประเด็นเนี้ยมาให้ทุกๆคน discussion กันก็เลยอยากให้ทุกคนเข้าใจได้ตรงกันด้วยครับ
ก็คือว่าคือจากงานวิจัยบางงานเนี่ยเขาเริ่มต้นด้วยการเก็บข้อมูลโดยใช้ quantitative research ก็คือเอาเครื่องมือนี่แหละครับไปเก็บไปวัดมาก็คือเริ่มจากควอนติแต่ว่าในระหว่างที่เก็บไปเนี่ยเขาก็มีการสอบถามเพิ่มเติมเกี่ยวกับปัญหาหรือว่าหัวข้อนั้นๆว่าเกิดปัญหาอะไรขึ้นอะไรอย่างเงี้ยครับแล้วก็ผู้วิจัยกลุ่มเนี้ยเขาก็เอาข้อมูลพวกเนี้ยมาใส่เป็นรีพอร์ตแล้วก็บางงานก็เคลมว่าของตัวเองเนี่ยเป็น mixed method ก็เลยคิดว่าก็เลยอยากถามว่างานแบบเนี้ยสามารถเคลมได้ไหมว่าเป็น mixed method ภายหลังจากการที่ไปเก็บข้อมูลมาแล้วโดยที่เริ่มต้นจาก quantitative อย่างเงี้ยครับ
Okay, so it seems like they start with quantitative questionnaire, right? After they get the data, they will interview more in detail of those information, and then the author claim that this kind of research is a mixed method. So that's why you're curious, is it like that or not? Because they start with quantitative part.
Okay, all right. So based on what we learned before about what is mixed method research, do you think that that study that was just described is mixed methods? Yes or no? Who would like to answer?
อาจารย์ถามกลับให้ทุกคนแชร์ครับเป็นเหมือน discussion กันว่าตามที่สุทัศน์ยกตัวอย่างมาใครคิดว่าเป็น mixed method หรือไม่ครับลองแชร์กันดู
May I try I think it's not a mixed method because as I understanding, I think when we do the mixed method, we will use the data after analysis from the first approach, and then use the data to use the data for the next step for the next approach. So it should be you finish the first approach and then start with the next approach. If we do two approach simultaneously, or maybe I think it depends on the question of or the purpose of the research. May I confuse? I think it maybe it can be do if it depends on the question of the research. Sometimes we may do simultaneously, but I'm not sure about the participant. It should be the same or not.
So our first opinion is maybe. All right. Anyone?
I confused a little bit.
So our first opinion is maybe. Someone else, what do you think? Does this study that was just described, is it mixed methods or not? Watchery, you look like you want to say something.
มันไม่ใช่ค่ะอาจารย์เพราะว่ามันก็ขึ้นอยู่กับดีไซน์ตั้งแต่ตอนแรกแล้วค่ะว่าเขาต้องการตอบคำถามการวิจัยในลักษณะของการเซอร์เวย์จาก quantitative แต่ว่าถ้าสมมุติว่าถ้าจะเป็น mixed method นะคะก็จะต้องมีไอเดียว่าเราต้องการอยากรู้เรื่องอะไรใน new idea ถึงใช้ทั้งสองวิธีในการวิจัยเพื่อที่จะให้ได้คำตอบในการศึกษานั้นๆค่ะก็คือมันไม่ได้ตั้งแต่ดีไซน์ตอนแรกแล้วค่ะอาจารย์ก็สรุปว่าไม่เป็น mixed method ค่ะ
She said that it should not be a mixed method since maybe the author the PI designed the kind of research to be quantitative and then explore for more information is not the originate idea that they want to do both data collection as a mixed method. So that's why she thought it should not be a mixed method.
Okay, all right. We have one person who thinks maybe, and one person who says no, it's not mixed method. Any other opinions? Anyone who thinks that this may be mixed methods?
Yeah, Nathania.
Chen Kap?
Yeah, thank you. In my opinion, I think this method is not mixed methods. I agree with Ms. Washery because I think มันขึ้นอยู่กับตั้งแต่แรกในการดีไซน์แล้วก็ prioritize study. I think that
It depends on the original idea, what you want to do. So she think it's not.
So explain a little bit again. So the study was described as a mixed method research project in which they first started with quantitative survey. They got their survey results and then they conducted some qualitative work in order to better understand the results from the survey. Is that what the design was?
ครับ เหมือนอย่างที่อาจารย์พูดไหมอาจารย์พยายามที่จะ clarify situation ผมอธิบายอาจารย์ว่าก็คือมันเหมือนกับเริ่มต้นด้วย quantitative ก่อนหลังจากได้ข้อมูลมาคืออาจจะมีบางส่วนที่ไม่เคลียร์อย่างนั้นหรือเปล่าเลยมา interview เพิ่ม
ใช่ครับ
ใช่ไหม
ใช่ครับ
Okay yeah he confirmed like that
Okay.
so how do you Suthat how you think on your personal idea how do you think
โดย
is
โด
it
ยส่วน
mixed
ตัว
method or not
โดยส่วนตัวเนี่ยที่เจอแล้วก็เห็นงานเนี้ยค่ะก็คือก็แย้งในใจว่ามันไม่น่าจะใช่เป็นมิกเมธอดเพราะว่าโดยส่วนตัวเนี่ยครับคิดว่าถ้าสมมุติว่าตัวผู้วิจัยเองเนี่ยมีการวางกรอบแนวคิดหรือว่าวางคำถาม แล้วก็เป็นคำถามที่แบบผ่านการตรวจสอบอะไรเรียบร้อยแล้วถึงจะนำไปถามparticipant เนี่ยอันเนี้ยคิดว่าถึงจะใช่ แต่อันนั้นน่ะมันเหมือนเป็นแบบสิ่งที่ได้มาเพิ่มเติมหรือว่าข้อคิดเห็นเพิ่มเติมเกี่ยวกับปัญหาที่เกิดขึ้น มันน่าจะเหมือนการ clarify ปัญหานั้นแบบเฉยๆมันยังไม่ถึงกับ
Okay
อะไรอย่างเงี้ยครับอาจารย์ประมาณนี้
Yeah
ก็เลยบอกว่ายังไม่
Yeah,
ใช่
he said that that research seem like they collect the quantitative data and then they see some issue in there, so they explore for more information. But it seems like it's not come up as the beginning design on what it is.
Okay, great. I love this discussion. So, yes, it is a mixed method design. It is mixed method research because at the basic level, mixed method research is the use of quantitative and qualitative results to answer a research question. Now, did they follow the protocol, best practices for describing their mixed method research? Most mixed method research, many pure mixed method research design should start with a clear explanation of this is a mixed method study. We're using these two types of approaches and why. And throughout all the data collection processes, they tell you the mixed methods design, the sequence, the priority, and when the results will be integrated. That's best practices for the reporting of a mixed method study. But technically, what they did was a mixed method study because they had some quantitative research and they followed up with an attempt to further explain it by using a qualitative method. So the short answer is yes, it's mixed methods. The long answer is they did not report it in a way that has been established now as best practices. So good discussion. Yeah.
เคลียร์ไหมครับหรืออยากจะ discuss เพิ่มเติมไหม Is it clear enough for all of you or you want to discuss more
อาจารย์บอ
I
ย
am clear
You okay Suthat
yeah
Okay
Okay. So this is interesting because
sorry เด่นละออง do you have anything
Yes, I หนูมีหนึ่งคำถามนะคะอาจารย์อยากจะให้อาจารย์Professor แชร์เกี่ยวกับปัญหาและก็อุปสรรคที่อาจจะต้องเจอในการที่แบบทำวิจัยที่เป็น Mixed Method ในนักวิจัยหน้าใหม่ที่ไม่เคยมีประสบการณ์นะคะว่าในการทำวิจัยเรื่องนี้อาจารย์เจอกับปัญหาอะไรบ้างอะไรประมาณเนี้ยค่ะ
Okay,
อาจารย์
let me ask Professor Dr. Matthews and or maybe like she asking about we are a new researcher and if we want to conduct a mixed method, what is the common issue that we have and how we overcome with that? Do you want to discuss it now?
let's discuss it in a little bit after we talk about some of the things that you really have to keep in mind when you're conducting mixed methods research. Yeah, good question. Don't let me forget. We'll come back to that. So what we were describing about that article was the difference between a method, mixed methods, and appropriate reporting of a mixed method design. A number of years ago, the National Institutes of Health decided that intervention research, a lot of intervention research was being conducted, but the reporting in the literature was very poor. A lot of key information was being left out. So the National Institutes of Health established that, and journals agree, that any study that is reporting on a randomized clinical trial must follow the consort statement and include the consort diagram for what has to be reported in a randomized clinical trial. All journals now check that, and if you don't use the consort guidelines, then your paper will be sent back or rejected. Why? Because the way that we establish the rigor of a study is to have all clear descriptions each phase of the study. And so the National Institutes of Health provided guidance on that. Mixed methods is a newer area of research. And so people have been conducting mixed methods research, but not using best practices in terms of reporting and design. Now there are guidelines for how to report mixed methods research studies designs. Just like the consort statement, there are guidelines for how to report them now. And if you don't follow those guidelines, the journal editors will send it back and say, you have not followed the best practices for describing this type of research. Please revise. So that is what we're seeing. And there hasn't been full adoption yet of that best practices guidelines. So maybe that was an older article or a journal published that was not quite Q1. Okay, so good question. Thank you for that. All right. So we were just talking about our sequence, right? First, we had to decide, just as review, first we had to decide what was our priority, qualitative, quantitative, etc. Now we're looking at the sequence. What order do we collect the data? The first one was concurrent, parallel at the same time. Now we're doing sequential designs. This is where one data set builds on the results of another. So in this approach, we collect our qualitative data to help us explain a phenomenon. We will get very in-depth information. We will analyze that. And then the purpose of the research question was to use that information to inform instrument development. So in our methods, we would say we're using a sequential design in which we are going to start with qualitative methods to explore more in-depthly about a phenomenon. We're going to complete that completely, analyze the data, and then develop a new data collection for quantitative for survey development and evaluation, okay? So this is part of the same study. The ultimate goal is to develop and validate a survey instrument, and it will use a mixed method design that is sequential in nature. Qualitative, instrument development, instrument testing. That's a sequential design. Okay, so here is a picture. All right, we do our quantitative phase, for example, then followed by qualitative, and then final interpretation and finalization of the research project. Quantitative can come first or qualitative can come first. It depends on what is the goal and objective. But this is a sequential design where they will completely close one phase of the study before moving on to another phase. But again, clearly they have proposed mixed methods to develop a survey instrument and to collect reliability and validity data. And in doing so, they use the sequential design. Okay. I will often use a sequential design in the development of an intervention. Okay. I will use, let me see if I talk about that, how much I talk about. Okay. I will first start with a qualitative design. I will, so in the context of a smoking project, this is a use of a sequential design to develop intervention, a culturally targeted intervention for African-American men who are HIV positive. Okay. The first step of that design was I needed to understand what does this population has high rates of smoking. And one needed to understand what did they know about smoking as it relates to their HIV? How much a priority was smoking cessation? What have they tried? What were the things that were wanting them to make a quit attempt? And what did they see as barriers to quitting? I first conducted qualitative interviews, focus groups. I gathered all of that information. I then developed used an evidence-based intervention, but used the information from the qualitative phase to add targeted information about the risk of smoking among patients who are HIV positive, the fact that smoking interferes with their antiretroviral medication, making them at greater risk for developing AIDS and dying from an AIDS-related disease, and considering some of the barriers and facilitators that they discussed, and including what type of messaging and materials that they wanted that they thought would be effective. I developed adapted the intervention. I got some qualitative and quantitative feedback on the materials that I developed, finalized the materials and the intervention approach. That was done. And then the third and final phase was I tested the intervention, the smoking cessation intervention. It was a sequential design, equally relying on qualitative and quantitative strategies with the ultimate goal of intervention development and testing. That's an example of a sequential design, right? And here's a paper that describes that process, development and testing of a targeted smoking cessation treatment. Okay. Now, that's sequential. This one is a little bit harder to think about. So this is what's called an embedded design. We had concurrent design, we had sequential design. Now we're looking at embedded design. This is, let me show you the picture. It's easier to explain it that way. Here's the picture of what it looks like. The primary emphasis is on quantitative with a secondary goal of qualitative. We start the quantitative analysis, survey data collection. After we finish survey data on about 25 to 30 participants, we do a preliminary analysis of the quantitative data, and then we summarize the quantitative data, give us some, um, put together a focus group or qualitative interviews to give us some preliminary feedback on the data that we were finding in the quantitative survey. Okay, if there was any problems that we maybe had with missing information or missing questions, if there were some problems with the reliability of an instrument, if there were some problems with the ways in which the scores were, the scores for this sample on standardized measures were different from some other previously published. Here we want to get some understanding of what's something that's weird with our data collection. This is a new instrument, or we're using this instrument for a new population. So we have decided that we will start with our quantitative data, stop at about 25 or 30 participants, do an initial evaluation, and then work with qualitative interviews to try to help us to problem solve or fix or better understand some issues that we're seeing with our survey, either missing data or results or some other concern. Then we go back to, we may refine our data collection methods. We may provide additional explanation if we're finding that some people aren't understanding the question or the response categories were too complicated. We may do some refining, and then we will finish our data collection. Okay, then we will then the next phase is then the interpretation of the quantitative data. So that's an example of an embedded design in which we start off with a priority for quantitative study and analysis, but we have some concerns that we may need to get some feedback on our instrument or our approaches. We decide in advance that when we're going to stop, what type of qualitative information we're going to collect, then we continue with our data collection, right? That's embedded design. I know you have questions.
In the chat box right now, another question from the audience, they asked about in the research, like an experimental, which is like a separate into 3 phases, for example, like that. And if they collect
This one here?
yeah,
Okay.
maybe, yeah. They just ask like if they separate the phase of research into 3 phases and they collect the data using the qualitative study and also have a focus group discussion to evaluate the intervention like this, do you think is it a mixed method or not?
Okay, so let's go back to our basic definition. A basic definition of mixed method research is anytime we use a combination of qualitative and quantitative approaches to fully understand a phenomenon, to evaluate and interpret quantitative findings, or to evaluate results of an intervention. So there's many different ways in which we can use mixed method mixed method designs. I think where we're getting caught up with is that the powerful thing about mixed method designs is that it will not look the same from one study to the next study to the next study. Why? Because there's many things that we can do innovatively and differently. We can think about priority, right? We can have innovation in priority. So the study might look, one study might have one approach to priority, it might have one approach to sequencing, and it might have an approach to integration. That's mixed methods. A whole other study might have a emphasis on priority, sequence, and integration. So those combinations of three design issues plus any number of research questions plus any numbers of qualitative approaches such as focus groups, interviews, or observation, or any number of quantitative approaches, surveys, online data, intervention, secondary data analysis, can result in a million different designs. When you combine each of those three things, you can have 1,000 different designs. So it will look different from study to study to study to study based on the research question and the decision making for priority, sequence, and integration, and the particular qualitative method approach and the particular quantitative methods or approaches. So if it is utilizing a combination of qualitative and quantitative methods, it is always mixed methods.
ครับอาจารย์ก็พยายามจะสรุปให้อีกทีหนึ่งนะครับว่า mix method เนี่ยมันเป็นได้หลายแบบไม่ว่าจะเริ่มแบบไหนเนาะหรือดีไซน์ยังไงอย่างที่อาจารย์พยายามอธิบายว่ามัน mix method เองก็แบ่งเป็นหลายๆรูปแบบดีไซน์แต่คอนเซปต์หรือ fundamental ของ mix method ที่อาจารย์พยายามจะพูดก็คือการเก็บข้อมูลที่มีทั้งสองส่วนคือ qualitative กับ quantitative ครับเพราะฉะนั้นถ้างานวิจัยนั้นๆมีการเก็บข้อมูลทั้งสองรูปแบบก็สามารถ consider ได้ว่า it is a mixed method right if you collect data both technique using the quantitative or qualitative strategy or whatever even though what the design you're gonna do like a what is the starting first or you're gonna do it again is still be a mixed method correct
Yeah. So if we all of us here were given the exact same research question, each of us would, and we were asked to use a mixed method design, and we were given no further instructions than that, all 21 of us who are here, or 19 of us who are here, I can guarantee you would come up with a unique and completely different design based on how we wanted to collect our qualitative data, what was the priority, what was the sequence, how we collected our quantitative data, did we need to do some development, instrument development, or in our design, did we want to do some intervention approach, okay? So the specifics are not what's in, the specifics can vary a great deal, and they are related to these three types of decisions, but the way that they're integrated can be integrated in many, many different ways. There's no one way. So don't keep looking for the one exact thing that means mixed methods. Understand that mixed methods is a robust approach to answering research questions that uses a combination of qualitative and quantitative methods. Okay. Yep. Good time for break.
I think we can take a break for like a 5 minutes. So it is like a 4:23. Please come back at 4:30. Okay, and then we're gonna start and maybe come back to another questions that you leave in the chat box.
Okay. All right. enjoy your break, move around a little bit, have a little snack, and I'll see you in a few minutes. Bye. Okay, friends, welcome back. Looks like we have a couple of questions follow up with on the chat box. Can you help? We have some, it's written in Thai, sorry.
Okay. Please welcome all of you back to the half last one, right? I don't know yet.
Yeah.
So I see you have questionnaire question. I'm so sorry. It seems like there's many things in my hands right now. You have 2 questions so far. You want to go to that question first about the barriers and way out, or you want to go to the end to do the mixed method?
Barriers to mixed methods. Let's wait to the end.
Okay. So the second one, they're asking about the way to interpret the research result. It must be a comparison with the literature only, or it can be compared with the objective of the research.
First, you analyze your results and the objective of the research. Next, then you compare your findings to the literature. That's the case, that's the case for all research. You answer your research question, and then you compare your results to your results to the literature. You compare it, and these typical 3 ways. Is it consistent with the literature? Is it different from the literature? Or is it a new finding that hasn't been introduced in the literature? All right, so that's how you, when you're in your discussion section, when you're comparing your findings to the literature, those are the questions that you're asking yourself. I review the literature, my results are very consistent to what is being found. Or my results are completely opposite than the literature, and I try to explain why. Either my population is different, or I used a different approach, or my approach was more rigorous and I have more trust in my findings compared to the literature. So what might I mean by that? For example, if I do a smoking cessation intervention, many people will report only self-reported outcomes. We know self-report smoking rates after an intervention are usually higher than what is actually their quit rates. So if my overall quit rates in my intervention might be lower than what's reported in the literature, but I confirmed my quit rates using an objective breathalyzer. So my lower quit rates are more trustworthy. They're probably a more accurate reflection of actual quit outcomes compared to the literature. So that would be the argument that I would make, right?
Whether design, either like a quantitative, qualitative, or mixed method, the way that we try to discuss and interpret the result, it should based on the objective and then compare with the literature นะครับก็คือไม่ว่าจะเป็นดีไซน์แบบไหนก็คือเราก็ยังใช้หลักการเดียวกันก็คือต้อง follow ตาม objective ก่อนหลังจากนั้นก็คือใช้การ compare กับ reference หรือ evidence ต่างๆเนาะ The last question so far right now regarding the sequential design in the phase 3 the sample size for testing should be select based on the quantitative or qualitative.
All right. What methods do we use for intervention testing? That's a quantitative methodology, and we have to use a sample size calculation to establish the sample size for that. If Okay, so phase 3 testing, I'm sorry, sometimes I have too many things to say. So for phase 3 testing, it can be a feasibility study, it could be a pre-test, post-test, pilot test, or it can be a randomized clinical trial. Each of those designs and purposes require a different sample size. So phase 3 is a quantitative approach. You need to use quantitative estimates to establish the sample size, but it also depends on the purpose of the testing. Are you testing feasibility? In which case you usually need very few, 10 to 15 participants. Feasibility testing means, can you do the intervention? Pilot testing is usually a little bit larger, usually around 40 participants. You use a pre-test, post-test design, and then the randomized clinical trial, that's when you have to have a sample size calculation.
ครับอาจารย์ก็บอกว่าในส่วนของ testing เนี่ยเป็นส่วนของ quantitative เนาะเพราะฉะนั้นเนี่ยแต่ว่า quantitative เนี่ยก็ขึ้นอยู่กับวิธีการที่เราจะใช้ด้วยว่าเราจะใช้ทดสอบอะไรนะครับจะเป็น feasibility คือความสะดวกในการนำไปใช้หรือเป็น pilot testing หรือเป็นintervention right อย่างไรก็ตามไม่ว่าจะเป็นวิธีการใดอ่ะก็ต้องใช้วิธีการคำนวณโดยเฉพาะวิธีสุดท้ายแต่2วิธีแรกเนี่ยมันเป็น rule of thumb นิดหน่อยเนาะอย่างเช่น feasibility ก็คือประมาณ15-30 คนถูกไหมครับ pilot test ก็ประมาณ40 คนยังไงก็แล้วแต่ขอให้มีอะไรล่ะหลักการในการคำนวณกลุ่มตัวอย่างไม่ว่าคุณจะเทสมันแบบไหนก็แล้วแต่ครับ
So, I think Thought, how do you pronounce that? Looks like he has a question. And
ฟังพยายามจะเรียกสุทัศน์เพราะว่าอาจารย์บอกว่าเอ๊ะดูเหมือนสุทัศน์ have any question
I can see from his eye he has a question.
ขออนุญาตสอบถามเพิ่มเติมอีกนิดนึงครับอาจารย์ก็คือตอนนี้เริ่มเข้าใจแล้วในเรื่องของ mixed method นะครับแต่ว่ายังมีข้อสงสัยก็คือว่าถ้าสมมติว่าในกรณีที่เราเป็น quantitative หรือว่าเป็น qualitative มาก่อนเนี่ยแล้วกำลังคิดถึงจริยธรรมอะครับอาจารย์ถ้าสมมติว่าเราผ่านจริยธรรมไปแล้วเราไปเก็บแล้วสมมติว่าเป็นควอนติอยู่ดีๆแล้วก็ไปเก็บแบบเชิงคุณภาพมาด้วยมันจะมีปัญหาทางจริยธรรมหรือว่ามันต้องแก้ไขประเด็นนี้ยังไงก่อนหรือเปล่าครับตอนสรุปผลนะครับ
โอเคในกรณีถามสุทัศน์เพิ่มเติมหมายถึงว่าดีไซน์ตอนแรกที่เราวางแผนมาเนี่ยเป็นควอนติสมมุติอย่างนั้นใช่ไหม
ใช่
แต่
ค
พ
รั
อบ ไปเก็บข้อมูลเจออุปสรรค แล้ว
ใช่
อยากจะเก็บควอลิเพิ่มอย่างนั้น
ใช่
ถูกไหมครับ
ใช่ถูกครับ
เราจะดำเนินการยังไงกับ IRB ถูกไหมถ้า
ใช่
ผมเข้าใจอย่างนี้โอเค
ใช่
so he asking about for the initial design that he planned is gonna be like a quantitative part and once he done with the data collection he found that is some issue in there which is unclear he want to collect the qualitative information more how to deal is it any issue in terms of ethical thing or how we deal with the IRB
because it's a new concept that you're measuring, if I'm remembering correctly, the fear of death, you should assume that you will need some qualitative information to help you interpret and better understand the findings. So your design should be developed with the survey data collection and then qualitative interpretation and feedback. So you should design it in that way and get IRB approval for both phases of the study. Phase 1, X number of participants for the survey, and then phase 2, X number of participants to give you feedback.
อาจารย์ก็ให้ข้อเสนอแนะได้ดีและจำสุทัศน์ได้ดีด้วยว่าสุทัศน์ทำเกี่ยวกับ fear of death ซึ่งอาจารย์มองว่าในประเด็นที่สุทัศน์ทำเนี่ยก็ควรออกมาเป็น mixed method ก็ได้ครับเพื่อที่จะตัดปัญหาว่าไปทำอันแรกแบบนี้แล้วมาเพิ่มทีหลังนึกออกไหมเพราะฉะนั้นในมุมของอาจารย์คือ fear of death เนี่ยมันควรจะมีทั้ง quantitative and qualitative ดังนั้นเราก็ดีไซน์ตั้งแต่ตอนแรกเลยแล้วก็ยื่น IRB ไปแบบนี้เลยเพื่อที่จะได้ไม่มีปัญหาทีหลัง
Thank you Professor
do you have a developed measure of fear of death?
I I think maybe because in the previous time I have a literature review and the instrument of the fear of death is in another country, but in the Thailand there is they I think it in the context or something in the cultural in Thailand it may be different from the other country. Yeah.
So we don't have Thai version of the fear of death measurement, right?
Yeah, right now I don't have the Thai versions, and they have translate from other country and use in the Thai people. Yeah.
Yes or no, they have.
So หมายถึงว่าตอนเนี้ยมีแบบวัดฉบับภาษาไทยใช้หรือยังนะครับ fear of death
เหมือน
ถ้าสุทัศน์จะใช้
ยังไม่มีครับตอนนี้ก็
ยัง
คือ
ไม่มี
ใช่ครับ
no
Okay, so in that case, you need to propose a sequential design. The first step, phase 1, is translation, back translation, and CVI. So translation processes for the instrument. The second phase would be, as you described it, the second phase would be quantitative data collection. And then the third phase would be qualitative data collection.
ครับอาจารย์ก็เสนอ เพราะว่ามันไม่มีแบบวัดไทยเวอร์ชันถูกไหมยังไงถ้าสมมุติมีก็จะเป็นอีกกรณีหนึ่งแต่ถ้าไม่มีเนี่ยยังไงเราก็ต้องแปลเครื่องมือถูกปะครับอาจารย์ก็เลยบอกว่าถ้าเป็นอย่างเงี้ยใช้ sequential design ได้โดยเฟสแรกเนี่ยก็คือเป็น process ของ translation test เครื่องมือที่เราจะใช้เนี่ยให้เรียบร้อยว่ามันเหมาะกับไทย context เนาะหลังจากนั้นเฟส2ก็คือไปเก็บ quantity และเฟส3ก็ไปเก็บ quality จะได้เป็น sequential แล้วก็ submit ไปแบบนี้เพื่อที่ให้มันครอบคลุมทุกอย่าง
Thank you.
Okay. Now that we have your dissertation planned,
Maybe.
did he understand the joke? Okay. All right, where are we? Embedded designs, we talked about those. Okay, any questions here, embedded designs? This is when, so for example, in our dissertation that we're planning, we may do an embedded design as part of phase 2. So we might collect some data. So our ultimate sample size for our qualitative phase might be 150. We may say that after 25 participants, we are going to stop, analyze the data, and if there are any problems with reliability or missing data or weird responses, then you want to say we're going to have a small group of people give us some feedback around, what's going on here? Is this clear or not clear? All right. Then you would go back to your data collection, your quantitative data collection, and then follow up with a final focus group. All right. That would be, so again, these designs can be wild, but they're all mixed methods. All right. Okay. So now multi-phase study. Multi-phase studies will look like to you sequential design, but it's really focusing on answering a larger research question that's leading to a program of research, some of which might use any one phase of the study might use mixed methods. Some of it may use exclusively qualitative, and some of them may use exclusively quantitative. But the whole goal of the study is to develop an intervention or to complete an evidence-based practice study. But because it's a new area, we may need to do phase 1 study is only focusing, our ultimate goal is to do this survey to understand fear of death in cardiac populations. All right? That's our ultimate research goal. But because this is a brand new area of research, for us to get to that ultimate goal, we need to do a series of studies. It might start with a concept analysis, study 1. You do that as your master's. Then you might be followed up with a dissertation study that would look at instrument translation, survey collection, and instrument sort of validation. All right, we have so that's another study or series of study that's been conducted. Now, finally, we now want to collect data in our target population. Now we want to collect a sample of patients with recent heart attack and look at predictors of fear of death among new patients with a new heart attack. Then we say we know how common it is. What are the predictors of who's most likely to have this fear of death? And then our last phase, which would also be could be a multi-phase study, would to be develop a targeted intervention aimed at reducing fear of a new heart attack or new death among new patients with a recent heart attack. That would be an example of a program of research that was ultimately focusing on interventions in a clinical population, but that required many studies that built on one another, and that would be conducted over a series of many, many years. Okay, that's an example of a multi-phase study. Okay, it's different from sequential study because sequential design, I'm doing each of these pieces close together, right? I know that my ultimate goal is to test this brief intervention. I have all my measures. I know all those things. Here, I just want to get a little bit of qualitative information for targeting. I want to get feedback about my intervention, and now I'm going to test it. That's a sequential design. That's different from multi-phase, which is a number of studies that are conducted over time that is leading to an ultimate goal. Okay. All right. So study 1 might be quantitative, but it informs the next phase, which might be qualitative, which is leading to another mixed method study, which might be leading to another quantitative study that finally leads to an intervention study. Okay. So multi-phase design. This might look like what you do over the course of 10, 15 years. Okay. All right. How much time? So any questions about any of those things? I want to now share with you a multi-phase study that is related to the development of a lung cancer screening intervention for Chinese Americans. So the context of this research, the ultimate goal of our research is to address the problem of high rates of lung cancer death among immigrant Chinese Americans. So you'll notice when I talk to you about my research, I always embed it in a health problem. Okay? So just like, here's another example. The problem that I'm trying to address is high rates of lung cancer among Chinese American men who smoke. That's the problem. The issue, the way that we are proposing to reduce that problem is to increase engagement in lung cancer screening among this population. What's our strategy? Our method for increasing lung cancer screening is to develop culturally and linguistically targeted decision aids, educational materials that are aimed at helping this population understand risk for lung cancer, understand the importance of early detection, to understand that they have an evidence-based lung cancer screening intervention, lung cancer screening procedure, and to understand if they're eligible, and if they are eligible, how to obtain screening. But the first thing that we needed to do in this goal was to understand, what do people already know about lung cancer screening? Because this is a relatively new early detection test, not many people use it, not many people have heard about it, and very little research has been done on lung cancer screening among Chinese Americans. So we needed to start with some early phase formative developmental research to tell us, what do they already know and how do they think about it? So the first step was that we recruited a sample of Chinese Americans, both men and women, who are current and former smokers who live in Chicago. The background there is Chicago. Chinatown is very close to the downtown area. We conducted the study in a community setting in Chinatown at the library. It was a combination of individual interviews and group discussion. So here's my colleague. He was a former postdoctoral fellow of mine, Dr. Chien Ching Li. This is the community setting. He's given a presentation about lung cancer screening. At the end, he's inviting the participants in this educational program to give them some quantitative data about their smoking, right? And some added information about their attitudes and beliefs about lung cancer and lung cancer screening. So we had 50 participants. Here's the information on their smoking behavior. Here's the demographics on gender, smoking status, and their level of education. You could see that most of them were men who were former smokers who had a high school education or below, and they were older adults. So we asked them a series of questions on that survey. What's their level of agreement in terms of their risk for lung cancer? Only 1 in 4 thought that they were at risk for developing lung cancer. Have they ever heard about lung cancer screening? Only about 1/3 of them. And then we talked about some attitudes, right? Because if you're going to develop culturally targeted materials, you need to know some attitudinal information. So we ask about fatalism. We know that that's something that's in the literature. There's a lot of information about fatalism among Chinese Americans. They think that if you get cancer, you're going to die. Nothing's going to help you. And if you get cancer, it might be a punishment for something that you've done in this life or in your past life. And then some barriers related to cost. So we saw low risk, we saw low knowledge, we had a high degree of fatalism, misinformation, as well as costs being a barrier. So all of this, we knew that we needed to incorporate in our educational tools. The next step that we did was that after we collected the survey, we invited them to give us some feedback on an established educational tool for lung cancer. We use one that's been developed for the general population. We translated it into Mandarin and as is, and we showed it to them. We used the same participants that completed the survey for us, also completed the interview, the focus groups, talking about this cancer information. So here are some qualitative findings from the focus group about what they thought about this already established lung cancer screening decision aid. And we found out that culturally, they felt like it was not a good fit. They said there was too much detail. It was too complicated. It felt like pressure. So the way that the information was being presented felt like pressure. It was increasing their fear and their anxiety. And that there are different ways in which between Western United States culture for education and what was acceptable in China. So we took this information, we adapted it based on what they said, what we found in the survey and what they told us in the qualitative and what we also learned from the literature. So we translated the prior document to simple Chinese. We reduced the literacy level to low literacy and low number and calculation abilities. We made it shorter. We included cultural references, and we also stressed the importance of early detection as being able to be an effective way of reducing cancer deaths. Then we collected a whole new sample of participants. So this goes back to one of the earlier questions that we had. When do we want to use the same population and when do we want to use a new population? Because this first group had given us feedback on the survey, they gave us feedback on the original decision aids. Now we wanted a new sample because they received this group. Now they were too knowledgeable, right? They received education from the lecture. They completed a survey. They had a big discussion about lung cancer. And so they were no longer fresh eyes. So at this point, we recruited a new sample, 16 participants, to give us feedback on the acceptability of our decision aid. So individuals were shown the adapted materials and were asked to give us some quantitative data about how well they understood each of the sections, their information about symptoms, the screening criteria, et cetera, et cetera. So over 80% of the sample understood it. So we knew we were on good track. And then 88%, right, almost 90% said that this decision aid would help them to be informed about lung cancer screening and to help them to decide to go for lung cancer screening. This is a paper and pencil version. Now we decided that we also wanted to, because web-based, internet-based education has the opportunity to show videos, to have hyperlinks to answer more questions, to have calculation of eligibility criteria. So we translated that from the paper and pencil to a web-based version. And then we got feedback on the web-based version with a new sample of participants. Okay, so again, we had 22 participants, a group of new participants evaluate the web-based version. We saw high levels of acceptability, satisfaction, and perceived benefits of our tool. So each of these questions, each of these mini studies were moving towards the ultimate goal of having a finalized lung cancer screening decision aid that we could use as a part of a screening intervention. So our next phase of the study, this study right here, we just received a grant to now test the benefits of this decision aid for changes in knowledge, attitudes, and actual screening behaviors as a part of a pilot test. So here's an example of a sequential design using mixed methods that had the ultimate goal of intervention development and testing. So any questions about these series of studies? And as you can see, we did a lot of publication along the way. We published the information that we used to do the paper and pencil, and we were able to successfully publish the web-based version as well. So as long as you follow good research methods, you can publish a lot of your developmental research. Okay. Now let's look at data analysis. So with each of the type of data methods, qualitative or quantitative, we have different data analysis, appropriate data analysis approaches. So statistical analysis using the numbers from the surveys for description, comparing groups, or looking at relationships between variables. With the qualitative data, we use the text or images. We use codes and themes in order to be able to answer the research questions. Okay, so different data analysis practices and different data calculation approaches, right? So when you're doing the data analysis, again, we use our sample size, appropriate sample sizes for our qualitative approaches, appropriate sample sizes for our quantitative approaches. Now, here's how we analyze. The first step is the data preparation, meaning that you finalize and clean all of the quantitative data and the qualitative data. So if you have surveys, you have to enter the data, you have to do the data cleaning and the initial data description. If you have the quantitative data, you need to transcribe, have a code book, code the data, identify the themes, and then finalize those, okay? So the first step is your data preparation. The second step is the data analysis for the qualitative using established approaches. Then we analyze the quantitative data, again, using appropriate quantitative analysis. And then we integrate the findings. That's step 4. We integrate the findings. So here we now merge or combine the qualitative and quantitative findings to draw conclusions about our research questions. We may, again, there might be different points in which we integrate the findings. There might be different ways in which we're using the data, but in a triangulation approach, again, when we're putting equal emphasis on quantitative and qualitative, here we want to compare, contrast, and then come up with findings, interpretation of our findings based on both sources of information. So it really is a strong ability to analyze quantitative data, a strong ability to analyze qualitative data, and then the specialized skill of being able to integrate and interpret the combined results. That comes with experience, that comes with a lot of reading of qualitative method approaches, that comes with a lot of consultation with experts, okay? Then we report based on best practices for mixed method approaches. That's the processes for analysis. So what are some of the pros and cons of mixed methods research? Again, the positives are that it really does allow you to overcome the weaknesses of both approaches. If you only use one approach, combining them together allows you to have a much more robust approach. It allows you to answer questions that could not be answered by using one method alone. And it allows you to really have a different level of interpretation of results. The downsides are that it requires learning and specialization. It can be a little bit longer, more time consuming because you have different types of data collection, different types of analysis, and then the need to combine them. Now, when I say this, I don't want you to think automatically, I don't have time to do mixed methods, because remember the concurrent design, meaning that you collect qualitative data and do some survey data collection on your sample that helps to inform what you're also looking at in the interviews. So what do I mean by that? So a concurrent design that puts equal emphasis on qualitative and quantitative can happen within the same session. I might invite participants to a 2-hour focus group. The first 15 minutes is related to consent, the consenting process. The second 15 minutes, they will collect the survey data, the survey about their demographics, their knowledge, their attitudes. And then the last 90 minutes would be used on collecting the focus group interviews, right? So within a 2-hour time period, you can do a mixed method study. It's not impossible. But then you do have to analyze both type of data. You have to analyze the quantitative as well as the qualitative, and then integrate and interpret your findings. But don't feel like you can't do it because you have a short amount of time for your dissertation. You just have to make some decisions about what type of design that you would use, what's realistic for your time frame. You could also use, like a design that we talked about. You may translate an instrument. You may collect some survey data, some initial preliminary survey data on reliability. And then you can do some validation work with using interviews to try to better understand the thought processes of the participants who were answering the questions, right? So it is possible to use mixed methods for a dissertation. Usually after I finish this lecture and I get to this point where I talk about the pros and cons, all the students say, nope, can't do mixed methods. Too much, too hard, too long. You can't use some designs if you only have 1.5 to 2 years to do your study. You couldn't use a multi-phase, very large intervention development approach in the time frame, but you can do a multi-phase measurement translation, back translation, collect some preliminary results to get some valid from reliability data, and then do some follow-up information to get feedback about what interpretation of results. That is highly possible to do for a dissertation. Right? So in this example we've been using is we've been talking about a survey, right? But you could do the same thing if you wanted to develop educational materials for a target population. You could use mixed methods. Qualitative, use qualitative or quantitative to get feedback. So qualitative to get some ideas about what the educational needs were. Qualitative or quantitative to get some initial feedback on your materials, and then quantitative to evaluate the usability of and the perceived benefit of your educational materials. So there's a lot of different dissertation studies that would be appropriate for mixed methods research. Okay, now getting back to the question that was asked very, very early on. What are some of the barriers to conducting mixed method research? There are a few of them. Again, they can be overcome, but there are barriers that you need to think about. So one is resources and time being a resource, right? So mixed method research can take longer. And it can require more money because you have to collect data from 2 samples and potentially reimbursement for 2 samples or 3 samples. So it can cost more money. So more time and more money to complete the study. It also, you need a larger team to conduct the study, or for your dissertation committee, you need different types of expertise because you need someone with expertise in your quantitative methods and your qualitative methods, and if possible, someone with specific mixed methods research. So you need a little bit more of a specialized mentorship team or research team. Another limitation relates to page limits or word limitations of journals. Many journals now are reducing to 3,000 to 4,000 words or 15 to 18 pages, which is not a lot when you have to describe your mixed methods rationale, your designs, all of your procedures, all of your analysis, all of your interpretation and your discussion and results. So it can be sometimes harder to report all of the phases of your mixed method study in one journal article. But that's not always a requirement. Like I've shown you, sometimes we can break it up and have phase 1 be an article, and combined phase 2 and 3 into another article, okay? So that can sometimes help with the page limitations. Sampling is another issue. Should we use the same group? Should we not? How do we make those decisions? So those can sometimes require a lot of additional thought and consideration. And then finally, how do we combine the results and interpret the results from these 2 different data sets? And especially if they're inconsistent with one another. All right. So those are some of the barriers that have been identified. The person who asked the question earlier about barriers, let's see if I've addressed your question or there are other questions related to barriers that you might have.
อาจารย์ถามว่าที่อาจารย์ได้อธิบายในตรงนี้เนี่ยนะครับสามารถพอจะให้คำตอบได้ไหมจากที่เคยถามไว้ในเรื่องของ barriers หรือทางออกเนาะแต่ถ้าเกิดยังอยากจะได้เพิ่มเติมหรือยังไงอาจารย์ก็เปิดโอกาสให้สอบถามเพิ่มเติมได้ครับโอเคไหมครับ
โอเคค่ะอาจารย์ค่ะ
โอเค
ค่ะ Thank you Professor.
She got it? Okay. All right. Good. I'm glad we had a whole slide related to your question. All right. Now, best practices. It's a new area and there have been established best practices, a number of them. Here's one example, best practices for mixed methods research in the health sciences. This is a very useful document, and it was a specific report that was commissioned by the National Institutes of Health to provide guidance to the field. So when we think about reviewing mixed methods research, because we might be evaluating different mixed methods designs if we're planning to use that literature, and when we're thinking about our own mixed methods procedures, we want to know what are the best practices. So there are some guidelines, and here's a citation for you that describes some of the things that you need to take into consideration when you're evaluating the quality of mixed methods research. First, did they describe the justification for using a mixed methods approach to the research question? Again, this was something that was pointed out earlier. So one of us had an experience looking at a mixed method study where they didn't clearly describe at the beginning that this was indeed a mixed method study and why they were using it. So best practices for reporting mixed method study describe the justification for using mixed method approach, describe the mixed method design in terms of purpose, priority, sequence, and integration. All right. Each of these things we've discussed. Describe each method in terms of sampling, data analysis, data collection, and data analysis. So you would do it by phase. Phase 1, quantitative methods. All these details for all of your quantitative methods need to be laid out. You do the same thing for your qualitative methods and approaches, and then a separate section that talks about integration. Then you talk about any limitations and then any insights. Those are best practices for reviewing mixed methods literature, as well as developing mixed methods protocols and publishing in this area. So here's a tool that can be helpful for you to use. It tells us really what we need to be looking for when we're critiquing mixed methods research. I like to use, when I'm developing my own protocols, I like to use documents that tell me what are best practices and how do you look for sources of errors so that I can double check my own self, right? And so here it tells us, it gives us guidelines about what the question should be for the qualitative, the quantitative, the different designs, and then the mixed methods. So here's an example of a checklist that can be used. And there are others. So that's all I have for today. We have plenty of time for questions, both related to mixed methods, as well as your individual dissertation questions. And if you would like to think about and do a thought exercise about your dissertation project. But let's first start with any questions, bless you, any questions that you have about the mixed methods lecture.
เชิญได้เลยครับ ก็อาจารย์ก็เปิดโอกาสให้ทุกคนได้ลองดิสคัสสอบถามเพิ่มเติมเกี่ยวกับ Mixed Method ครับ
Let me ask you this. How many of you use the hands up icon? How many of you think you would be interested in doing mixed methods in the future?
อาจารย์ขอให้ใช้hands up icon ครับลองดูซิว่าใครที่วางแผนว่าอยากจะทำ Mixed Method ครับเชิญได้เลย
I'm trying to, yeah. So I can see everyone. Oh, that's what it is, sharing screen. Okay. Stop share. That wasn't it? That should do it, right? All right, well, you're just going to be the star of our discussion. Show you on the big screen. I don't know how to change.
It is that the long eye in the center of the screen right now. I try to change it to be like a small icon.
Oh, I don't know how to do it either. Okay, all right. So how many of you are interested in, I got it. How many of you are interested in mixed methods research? All right, show of hands again. I see 1, 2, 3. 3, only 3? Okay. Of those who are interested in mixed methods research, tell me why. Why are you interested in mixed methods research? Dr.
Yeah.
B, you look like you're interested.
Yeah, Professor. And I want to share how what I interested in mixed method. The past time I want to know about what's way to the good way in the improve in protect about inในวัยรุ่นนะคะลืมค่ะในเรื่องของการ prevention promotion and prevention ในเรื่องของ negative behavior ค่ะafter that now I think mixed method is choose me to know explore about problem in my area of interest more than qualitative only or quantitative only. I think this method is good way to how to know about my research question, Professor.
All right. Thank you. How about you, B? Why are you interested in mixed methods? How will it inform your research?
You can go ahead,ค่ะ. You can start first.
I want gonna be expertise about qualitative researcher and quantitative researcher in the future ค่ะ
Why do you think it will be helpful for your area of research? Because you'll need to explain why mixed methods. Why is it relevant for your work?
I think I interested in major depressive disorder like recovery. I like mixed method like help them for understand self-care management, and I think before they discharge from psychiatric hospital, maybe I think we can use the measure for screen self-care for them like help them not relapse in the future. I think it's
That's interesting. So what you're saying is that self-management is key for the recovery from depression. A variety of different things, right? Medication adherence, going to their therapist, self-care, learning coping. But so basic self-management should be offered to all patients. But there might be some patients who are at higher risk for poor self-management due to a number of factors. And so after the general education, you might be able to use a screening tool to identify patients who have high risk factors for poor self-management. And those individuals would then get a more intensive intervention to address those specific risk factors. So it's a way of thinking about good standard of care for psychiatric nursing is to train all patients for self-management. But it's cost effective to identify not all patients will need very intensive support for self-management. Some will and some won't. It would be really important to identify a screening measure that would help you to identify who are those individuals who are at risk for poor self-management and consequently relapse of their depression, who should be good candidates for more intensive self-management education and support at the time of discharge. Mm-hmm. So you're on an interesting area, just a matter of really honing in on where you want to, the next step in that process.
Yes ค่ะ
Okay,
ค่ะ
good.
เดลละอองค่ะ Professor I interesting in the mixed method. I think the only methodology of the research maybe it cannot to answer my research question. I think, and I want to professor to suggestion me I interesting in the area of interest is pregnancy women, and in the future if I use the mixed method I I think I start from the qualitative research design to in-depth interview the pregnancy women to find the problem and important issue, and then I plan to the construct the intervention to improve the self behavior and improve the health in the pregnancy woman, and in the fertility I plan to take the intervention. I can do it. Thank
In
you,
the
Professor.
future, not for the dissertation, in the future. All right.
Maybe
So you're interested in pregnant women, right? Now, pregnancy in and of itself isn't a disease, right? So what problems associated with pregnancy are you interested in?
for the example is stress in the pregnancy or the in the some population in pregnancy for the example is advanced maternal age. I interesting in there. Yes.
Did you say advanced maternal age? Did I understand that? Advanced maternal age. Okay.
Yeah.
So what are some of the consequences? Dr. B, you can help here. What are some of the consequences for birth outcomes associated with advanced maternal age? What are some of the typical what are some of the potential health risks associated with advanced maternal age? What are those?
I think to look at the complication during the pregnancy, like gestational diabetes mellitus or preeclampsia that usually occur because of the age as well.
Okay.
Yes, Professor. Thank you.
So you're interested in preeclampsia, right?
Maybe diabetes or maybe stress during pregnancy.
Mm.
Yeah.
During pregnancy. So we're remember our thought process. We're trying to have you identify what specific problem that you're interested in. Because unless we're clear about which specific problem, we can't describe a research project to address that problem. So each time you will hear me do this thought exercise, it's my attempt to get you to tell me what specific problem you're interested in, either better understanding or reducing. All right? So better understanding is descriptive research. It could be qualitative or quantitative. Reducing would be more focused on understanding the risk factors or development of an intervention to try to reduce. So there's no way of designing you thinking about methods without understanding what specific question, without understanding what specific problem you're trying to address and what aspect of that problem are you focusing on specifically. The answers to those two questions then allow us to start thinking about specific questions, research designs, and approaches. Okay? But if we're too vague, because pregnancy isn't a problem, it's not a disorder, fear of death isn't a disorder, right? Pregnancy is universal. Fear of death is universal. So what aspect of pregnancy, what aspect of fear of death is a problem that you want to address? So we go from our big concepts or big general area to focusing on what specific problem is associated with that and where we want to focus our attention, either on better understanding, better describing, better understanding the risk factors, or better understanding intervention approaches. Okay, that's the way we move from vague interests to specific research design. Is that clear? Okay. All right. So
Thank
when
you,
you said
Prof.
earlier, I want to do mixed methods research for pregnant women, starting with qualitative, I can't say if that's right or wrong because I don't know what your problem is. I don't know what your question is. So I can't determine whether or not it's appropriate to start with qualitative or not. Okay? Methods are driven by research questions. Research questions are driven by research health problems, right? Research questions follow a health problem. Research design follows the research question. That's how it happens. We can't decide one without clearly thinking through the sequence. Problem, what aspect of the problem am I interested in? What's my specific question as it relates to that aspect of the problem that I'm interested in? And given my specific research question, what is the most appropriate research design? That's critical. That's the logic of identifying a research project and proposal. That's the critical analysis that you need to do at each step in defining a research protocol. Okay. Okay. Ajan, it looked like you had Ajan Kong. It looked like you were about to add something to the discussion. Did you have a comment you wanted to make? Dr. Kong?
Yes. Okay. Okay. I learned a lot of you about the mixed method, and I have one or two projects. Okay, this is a big mixed method. I am wondering about this. I share for my knowledge about the mixed method. Some research, like Suthat said, the researcher only collect the data from the quantitative and qualitative. This is like a survey, but it has a survey question and it has a open end of the question also. You understand I say? And the researcher claim this is a mixed method design. I think it is not. I think it is not, but it cannot separate of the data to to publication of this. I think it is only one research that, but it is only the I mean only the collecting only the data. It is not the sequence of the method of the qualitative research. Yeah. Okay. That's I think that if the mixed methods up to the phenomena and the phenomena of interest, and it has a problem, research problem, and the research problem lead to use a mixed method because only one method cannot answer the question. It need two method to answer that. I think this one. Yeah, I share with you. Yeah.
Yeah, that's absolutely correct. And in best practices for mixed method protocol development, you have to clearly say in the beginning why you need mixed methods to answer the question and describe all of your processes for it. So yes, that is absolutely the case. Now let's think about the question of if I collect a survey and I have open-ended questions, is that mixed methods? I would say not unless they described in advance that they were conducting a mixed methods research design, and here is why. It is not necessarily true that if they on one survey, they ask some open-ended questions, and then they say, now it's mixed methods. I agree with you there. But there's now that you raised that interesting part, how do we think about those data? From the survey, if we have quantitative variables and some open-ended qualitative variables, do those all need to be reported in the same manuscript, or can they be reported in two separate papers? Now that's the question I want to put to the group. If I conduct a survey, I have quantitative and qualitative data. Do all the data have to be reported in the exact same manuscript? Can you translate?
ครับอาจารย์ก็ฝากคำถามต่อเนื่องจากที่ท่านอาจารย์พงศ์ประกาศลิสต์ไว้เมื่อกี้เนาะว่าไอคำถามแบบนั้นจะเป็น mixed method ได้ไหมแต่พอดีมีประเด็นที่อาจารย์พงศ์ประกาศลิสต์ขึ้นมาว่าเป็นเปเปอร์แยกอาจารย์ก็เลยลองถามดูครับว่าถ้าสมมุติเราเก็บข้อมูลโดย data set นั้นน่ะงานที่เราเก็บเนี่ยมีทั้ง quanti และ quali ในอันเดียวกันเลยเวลาเราทำเมนูสคริปต์เนี่ยมันควรจะเป็นเมนูสคริปต์เดียวหรือมันควรจะเป็นแยกอาจารย์ลองถามดูว่าทุกคนคิดยังไงว่า it should be one manuscript combine both data from qualitative and quantitative or it should be a separate paper between quantitative one manuscript qualitative another one manuscript
What do we think
คิดยังไงครับ
For me I think sorry ค่ะ go ahead
yes go ahead
สุทัศน์
I think that's either one paper to make the manuscript because of the question of the research. We design about the mixed method and answer or the result of the research project that can describe in the last process or the last phase. We cannot separate in the qualitative or quantitative. That not separate two paper. Yeah.
Okay. What do you think? And that example from our one survey with qualitative and quantitative, can we separate those into two separate publications?
I don't think it's a good idea to separate. It
Why
should
not?
be combined in one paper because it's kind of the information that add on. Like for the survey, you get the number, but for the open-end question, you get the content and or context to explain why that number happens, why it's a high number or why it's a low number. So
Okay.
make that like report more complete.
Okay. All right. One more opinion. So far we're thinking, no, it's a
No.
terrible idea. Any other different opinion than that?
มีใครเห็นต่างจากที่สองคนทั้งสองท่านคิดไหมครับ
อาจารย์ค่ะขออนุญาตค่ะหนู
วัชรี yes
ค่ะหนูคิดว่าน่าจะสามารถทำเป็น2เปเปอร์ได้ค่ะ เพราะว่าขึ้นอยู่กับคำถามการวิจัยอะค่ะอาจารย์ ถ้าคำถามการวิจัยก็คือmixed method มันก็คือใช้2ดีไซน์อะค่ะอาจารย์ แต่ว่าอาจจะตีพิมพ์ร่วมได้ใน1 article เหมือนที่ท่านอาจารย์แนะนำว่ามันจะ complete อะค่ะ แต่ว่ามันก็จะมีแบบว่าอีกคำถามหนึ่งที่เราอาจจะรู้ในเชิงของคุณภาพเนี่ยค่ะ เราอาจจะไปตีพิมพ์ในลักษณะของเป็นคำถามที่2ของการวิจัยอะค่ะ ก็คือเราดีไซน์2คำถามการวิจัยดังนั้นก็คือ ถ้าเขาดีไซน์2คำถามการวิจัยตั้งแต่แรกอะค่ะอาจารย์ก็สามารถตีพิมพ์แยกได้ค่ะมีความเห็นค่ะอาจารย์
Yes, she think it can be two paper because it depends on the research question. Since she told that the mixed method is an idea that you combine data from two separate study, right? Design. One is quantity, one is quality. So it depends on the research design and research question. That's why she think it can be.
Absolutely. So very, very good. So in the design that I described for the genetic testing, remember we did the survey and then we did the focus groups. Those should not be separated. Both data sources were being used to answer one question. They were both contributing to that one question. Those should not be, I should not only do the survey and then a whole separate paper for the qualitative. No, that would be wrong. But if I did a sequential study in which I completely did a qualitative, my ultimate goal is to develop an intervention, I could not possibly describe in depth enough the whole qualitative study. My main goal for that first phase was to understand attitudes, knowledge, and beliefs. That was complete. So I can publish that. My objective in the next phase of the research is to get feedback on my adapted material. That is complete. I can publish that. Or more frequently, I combine my evaluation of my intervention description of my intervention development and evaluation with the results of my pilot test or the feasibility. So usually those two go together. So it depends on the objective and it depends on the question. Now, it is often the case, the reason I'm spending time with this is because I hear a lot of concern as I travel internationally about this idea of salami publishing, meaning publishing too many papers from the same data set. All right. The objective of that is to keep researchers from saying, here's my primary data, here's my primary research question. I analyze it to answer that primary research question, but I look, if my outcome is mental health, and I have 3 indicators of mental health, I should report on the predictors of mental health in that one paper. If it is in alignment with my research question, I'm interested in risk factors for poor mental health, including depression, anxiety, and stress in cardiac patients. If that is my research question, then my paper should be a description of all 3 mental health outcomes. One paper. I shouldn't say depression 1, anxiety 1, stress 1. That is what they're trying to get us to avoid doing. But within our analysis of each of these, the levels of stress, anxiety, and depression, we may notice that there are different risk factors for each of those outcomes. So it would be appropriate to say, what is the level of mental health disorders in a cardiac population? We answered that question. We report on depression, anxiety, and stress. Now, a completely separate paper, a completely separate research question is, what are the risk factors for poor mental health outcomes among cardiac patients? Now I ask I can use that same data set, but I'm asking a completely different and separate question than my first one. And that is acceptable. That is not an example of salami or over-reporting. Why? Because it is a completely different question. You might also pull out one of those outcomes. Why? Because you might have some qualitative data. So they might have completed a survey on depression, anxiety, stress, and then the levels. And then you might have asked some open-ended questions that say, what are the causes of your depression, anxiety, and stress? So that could be a third paper in which you would refer back to the prior 2 papers. This is a secondary data analysis in which our first publication looked at overall rates. Our second looked at predictors. And now we're interested in a qualitative description of risk factors for stress in this population. Again, that's now a different question. We're looking at the qualitative, description of what are the reasons why they feel so stressed, right? Maybe we didn't capture that. The reasons on the quantitative survey. So now this qualitative survey allows us to answer a new research question that we're asking from our data set. So I want to clarify that point, that secondary data or multiple publications from the same data set are not a problem if you are answering separate research questions and that you're making it clear that these additional studies are coming from a main study that has been previously reported on, okay? Transparency, okay? In that circumstance, no problem, no problem.
มีคำถามอีกไหมครับดร. แมทธิวก็ได้พยายามที่จะยกตัวอย่างให้เห็นภาพให้ชัดเจนเนาะจากการที่ประเด็นที่ถามว่าเป็น1 data set เนี่ยมันสามารถ separate ได้ไหม in term of mixed method อาจารย์ก็บอกว่าได้ขึ้นอยู่กับดีไซน์แล้วก็คำถามซึ่งก็ตรงไปตรงมานะครับแต่ในกรณีถ้าเป็น data set อื่นๆอย่างที่ผ่านมาเนี่ยอาจารย์ก็บอกว่าจริงๆก็ไม่มีปัญหาอะไรถ้าสมมุติเราตั้ง สามารถ differentiate ตัวข้อคำถามการวิจัยได้ที่แตกต่างนะครับไม่ใช่ว่าเราตั้งข้อคำถามการวิจัยเอาว่าศึกษาสุขภาพจิต3 ตัวในกลุ่มนี้แล้วอยู่ดีๆพอตอนเอามาตีพิมพ์ก็ไปดึงแต่ละตัวออกมาเขียนเป็นเมนูสคริปต์ซึ่งแบบนี้ก็อาจจะไม่เหมาะนะครับแต่ว่าถ้าสมมุติว่าทำแบบนั้นแต่เราพอตีพิมพ์ร่วมกันไปแล้ว3 ตัวแปลนั้นแต่ว่าเราอยากจะดึงบางตัวเข้ามาแต่เราใช้เมธอดอื่นหรือตัวแปรอื่นหรือคำถามการวิจัยอื่นเหมือนอย่างที่ตัวเองทำอันนี้ I'm giving them an example of that thing ผมก็ทำเหมือนกันแต่ผมก็ใช้เป็น mediator analysis moderator analysis ซึ่งจริงๆตัวแปรตามก็เป็นเหมือนกับตอนที่ทำ predict ครับเพียงแต่ว่าเราใช้ดีไซน์ใช้ตัวแปรรูปแบบใหม่ซึ่งก็เป็นที่ acceptable แล้วเราก็อธิบาย clearly transparency เลยครับว่าอันนี้เป็นsecondary data analysis ซึ่งมาจากงานวิจัยชิ้นเก่าอันนี้ก็ไม่มีปัญหาใดๆทั้งสิ้นแล้วเราก็ใช้วิธี analyze แบบใหม่นะครับอย่างเช่นทำ moderator mediator หรือถ้าคุณจะไปทำ structure equation modeling เพิ่มเติมก็ไม่มีปัญหาครับ
So the point here is that in most research studies, you will collect more data than you could possibly report in one paper. So the idea is that you, for the first paper, you report on the key objectives and the research question of your overall dissertation. That's your first question. Then from that data set, there are possibilities for you to publish secondary analysis from your manuscript, okay? So from your data set. So that's okay. As long as you're proposing a brand new question that can be answered from your existing data. That is fine. All right, we have been talking, I have been talking, and you have been listening well and participating, and it's been a great discussion. We're just about done, but I wanted to give Dr. B, we jumped over her earlier. Did you had a comment that you wanted to make about mixed methods and why it was good for your research? And then we'll end there.
Okay, thank you for giving me a chance to talk. I'm interested in prenatal stress, coping strategy, birth outcome, and breastfeeding. So I would like to get the meaning of the number that, like, we know that during COVID-19, the stress of pregnant women is higher. But right now it's post-pandemic. So I would like to know the stress level and also would like to understand the content, the context, why she's stressed. So that's why I'm deciding to use mixed method study. And for my research, since I have stress, coping strategy, birth outcome, and breastfeeding. So is it possible to relate can I separate my manuscript into 2 papers? The first one will be stress, coping strategy, and birth outcome. And the second paper will be stress and breastfeeding.
Yes. That's perfectly fine. What I want to suggest to you is that we are over the pandemic time, but not that far away from it. So I was just reviewing some WHO data that suggests that levels of depression and stress increased by 30% in the general population. Now, there were some variations in that, but it may have impacted the pregnancy or pre-pregnancy environment of the woman. And so one of the things that you might want to capture as a question that could be used for secondary analysis is what impacted the level of pandemic stress have on birth outcomes or pregnancy related stress. So we act as if we all went globally, we went through a very, very difficult time. And because it's no longer the immediate threat, it doesn't mean that that elevated stress is still not having impact on us in ways that we need to further explore. So in that example, if I'm measuring birth outcomes within a year of a pandemic, when we had high levels of anxiety, depression, probably differences in physical activity, probably in our data from the United States suggests we were drinking, smoking, and using drugs more, and our diet was changed. Those experiences may undoubtedly have consequences for subsequent birth experiences and outcomes. So that would be an example in which my primary questions might be about stress in this current pregnancy, but I might ask 2 or 3 additional questions about the pandemic experience that I could use for subsequent secondary analysis. It's not my main focal point, but I'm going to add that to my survey collection, because you hypothesize it's may or may not be directly related to your immediate question, but it's something that you want to have an opportunity to explore in the future. I recommend that for most of us here to ask a handful of questions that may not be immediately relevant for your research question at hand, but would allow you opportunities for preliminary data for another study, or to ask some additional exploratory questions. Yeah, thank you, B.
Thank you so much ค่ะ
So,
I-
I have a question.
Yes, please.
ค่ะอาจารย์ B and I we have the same team and we plan to use explanatory mixed method. So we start from quantitative approach, and we need to review literature in depth before we make our proposal, and we already done literature review. So my question is how I can maintain objectivity during qualitative data analysis. Actually, I know we can use peer review, but from your own experience, do you have anything to suggest us?
I didn't get the full.
พี่พี่เจี๊ยบถามอีกทีหนึ่งได้ไหมครับ
ค่ะ
อาจารย์ได้ยิน
we use explanatory approach, right? So for quantitative part, we need to do review literature, and sometimes as a two of us only, the researcher team, maybe we contaminate with some knowledge, some theoretical background. So it might affect on our qualitative data analysis. So I would like Dr. Matthew to share with us how can I control objectivity, or how can I control unintentional bias in qualitative data analysis.
So it mean like you try to do like what is that, the design, some design like that, right? And right now you are in the process. Yeah.
Since we start from quantitative research,
Quantity.
so we
Okay.
have to done review in depth,
Okay.
right? So that it might be effect to qualitative data
Result.
analysis part. Yes. So I would like Dr. Matthew to share with us
Oh, if you
how
use
to maintain the bias.
if you use the same sample participants from
Yes.
the quantitative to the qualitative path.
Yeah.
If it will introduce potential bias if if you are looking to evaluate something. So so if we're looking for an objective evaluation of materials or some information, individuals who have prior exposure that prior exposure through discussion and learning and that sort of thing can introduce bias, because now they're no longer new learners. They have some prior history. Sometimes depending on the research objective, sometimes you want them to have prior learning, because remember, we use there were some cases in which we used the same sample. But if my objective is to member check or to obtain information about whether or not we captured the correct information, then it's okay to use the same group. But if we're looking for some verification, generalization, or some new objective measure, then we want to have a different population. So it's how will the information be used? Will the information be used to confirm a decision or something that you've done? Or will the information be used to establish generalizability? If generalizability, different study. If different sample. If to confirm, same sample, okay.
But I think Dr. Chiap she want to know if like she complete with the quantitative data and then she try to analyze those qualitative part, how to protect or how to overcome the bias, right? If they use the same sample, right? Did I understand correctly?
Yes, I would like to avoid bias during this part.
What do you think the source of bias would be? Let's start there. What would be the source of bias?
Actually, I think the source of bias, it can be first the researcher team, because
Okay.
we already get the information, and since there are only two of us to run this project, so it might be effect to the qualitative data analysis.
Okay.
Yeah. Because she tried to tell that she complete with the quantitative part, review all literature. I think you can foresee, right? What is the result or the trend
Yes.
of the literature should be, and then she trying to start the qualitative analysis. Then it might interfere with the qualitative analysis based on the quantitative result, something like that.
Okay. Now, again, it depends on what your purpose is. Sometimes I like to have, if my objective is to develop targeted materials after a qualitative interview, I like to have a lot of pre-information. I like to know what the concerns are in the literature, because I will probe for what the literature has, or my prior research, I will probe for those same things in the qualitative. And then I can clearly see where new things are emerging. For me, that prior, because I'm not doing theory testing or theory development or phenomenology, where the idea is to have no preconceived research questions or knowledge, I use my qualitative information in a different way. And so the more information that I have, the better. Now, that doesn't mean that I can't carefully review. I need to objectively review what is there, but I am disciplined enough to say, this is confirming, this is new information, and this is disconfirming.
Ask for more. So by this thing, you think is not introduce any bias, right?
Not necessarily, not necessarily. But you can talk together as a team. What are your research questions? What's your code book? Who's going to be doing the coding? Who's going to be doing the analysis of the coding? Those are the places where bias is introduced. So be very careful about your decision making on who's the coder.
ขอสรุปคร่าวๆให้ทุกคนฟังนะครับคืออาจารย์เจี๊ยบเนี่ยถามมาเรื่อง mix method นี่แหละคือตอนแรกเนี่ยอาจารย์ complete เรื่อง quantitative part ไปแล้วรีวิวไปแล้วก็จะพอเห็นผลเนาะว่าลักษณะมันจะเป็นเทรนด์แบบนี้คราวนี้อาจารย์ก็เลย concern ว่าตอนนี้ในช่วงของทำ quali เนี่ยมันอาจจะ interfere กับไอเดียว่าทำให้ผลที่ได้มาเนี่ย bias แต่ดร. แมทธิวก็คิดว่า ไอ้ส่วนของ bias เนี่ยน่าจะเป็นประเด็นอื่นๆ เช่น member checking หรืออะไรต่างๆ แต่ในส่วนอันเนี้ยไม่น่าจะใช่ เพราะว่าอาจารย์ก็มองว่าถ้าเป็นอาจารย์คิดว่ามันดีซะอีกต่างหากที่ทำให้เห็นว่าสิ่งที่ทำมาน่ะมันมีอะไรเขาทำอะไรมา แล้วมันมีอะไรที่แปลกใหม่ เพื่อเอามาใช้ในการอะไรในส่วนนั้นหรือ interpret discussion ในส่วนนั้นเพิ่มเติม ก็อาจารย์ก็มองแบบนี้ครับ Very good, very nice discussion. I loved it, and it increased my knowledge as well based on your perspective. So I think we come to the end, but I know some of your students want to share something at the end, right? ใครอยากจะกล่าวอะไรกับอาจารย์ไหมครับ
เด่นละออไหม
ครับเดนละออง please.
เด่นละออ yes
Good evening, Professor. My name is Den Raong, the representative in the first year student nursing. Today, I think we have a lot to learn about specific lecture about mixed method. It make us to inspiration to make to do it. And I think our class is more understand for this issue. Thank you very much, Professor. Today. Thank you ค่ะ for today.
Thank you. It's a pleasure. And I like when we get to the point where we are comfortable with one another so that we ask questions, we discuss issues, and we can learn from one another. When in graduate school, the truth of the matter is that you will learn more from your peers than you will from any professor. So feel free to, it's important to get into a habit of talking with one another, discussing together these issues. As you noted, as you saw with our examples, there's no need to agree or disagree. No one's really right or really wrong. We're just learning and exploring these issues. We have different opinions, and then we try to come to some agreement of, okay, which of those opinions is most accurate right now? And that's fine. Nobody's smart, nobody's dumb. We learn together. It's okay. So I encourage you to embrace that approach.
Okay, thank you so much. And this is the real last one.